Welcome medical students. Today, we will discuss inguinal, umbilical, and hiatal hernias. We will cover their anatomy, classification, diagnosis, and surgical techniques. We'll also explore complications and management strategies to equip you for effective diagnosis and treatment. Let's begin this educational journey into hernias. The inguinal canal is an important anatomical structure in the lower abdomen. It forms during embryological development and can lead to hernias. It extends from the deep inguinal ring to the superficial inguinal ring, with structures like the spermatic cord and round ligament passing through. Inguinal ligaments and various blood vessels and nerves provide support and innervation. Inguinal hernias are classified into direct, indirect, and femoral types based on their location and structures involved. Direct hernias protrude through a weak spot in the transversalis fascia, while indirect hernias pass through the deep inguinal ring into the scrotum or labia majora. Femoral hernias appear as a bulge below the inguinal ligaments. Each subtype has specific clinical features. Various factors contribute to the development of inguinal hernias. Increased intra-abdominal pressure, such as from chronic coughing, heavy lifting, or straining during bowel movements, can weaken the abdominal wall and predispose individuals to herniation. Genetic factors also play a role, with certain connective tissue disorders, such as Ehlers-Danlos syndrome, increasing the risk of hernia formation. Understanding these triggers and mechanisms is crucial for both prevention and treatment strategies. A thorough physical examination, including inspection, palpation, and maneuvers like cough impulse testing, is essential for diagnosing inguinal hernias. Differentiating hernias from other abdominal pathologies, such as lymphadenopathy or lipomas, requires careful evaluation. Understanding the characteristic findings, such as a reducible bulge in the groin or scrotum, can aid in accurate diagnosis. Additionally, healthcare providers must be proficient in differentiating direct and indirect hernias based on their location and clinical presentation. Imaging techniques, such as ultrasound, CT, and MRI, can help diagnose inguinal hernias. Ultrasound provides real-time visualization, while CT and MRI offer more detailed views, especially in complex cases. Each modality has strengths and limitations, so the choice depends on the clinical situation. The surgical management of inguinal hernias involves various approaches, both open and minimally invasive. Open techniques, such as the Scholdice and Bassini repairs, involve direct visualization and manual reduction of the hernia sac, followed by primary tissue repair. Minimally invasive options, such as laparoscopic and robotic-assisted repairs, utilize small incisions and specialized instruments to repair the hernia with the aid of a mesh. Each technique has its advantages and potential complications, which must be considered when deciding the appropriate surgical approach. Despite advancements in surgical techniques, complications can arise following inguinal hernia repair. Recurrence, the most common complication, may occur due to factors such as poor surgical technique, inadequate mesh coverage, or patient-related factors. Mesh-related complications, such as infection or foreign body reaction, are also possible. Chronic pain is another potential complication that may significantly impact the patient's quality of life. Proper prevention, patient selection, and management strategies are essential in reducing the incidence and impact of these complications. Umbilical hernias, although more commonly seen in children, can also occur in adults. The pathophysiology involves a weakness in the umbilical ring, allowing protrusion of intra-abdominal contents. Risk factors for umbilical hernias in adults include obesity, multiple pregnancies, previous abdominal surgeries, and connective tissue disorders. Understanding the underlying mechanisms and identifying these risk factors can aid in both prevention and treatment strategies. Umbilical hernias are frequently encountered in pediatric patients and often resolve spontaneously within the first few years of life. Observation is the primary management approach for small, asymptomatic hernias. However, surgical intervention may be necessary for larger hernias, those causing complications, for example, incarceration or strangulation, or those that persist beyond a certain age. Factors such as the child's age, size of the hernia, and associated symptoms guide the decision-making process. Laparoscopic repair has become an increasingly popular approach for the management of umbilical hernias in adults. The technique involves creating an extraperitoneal space, reducing the hernia sac, and reinforcing the weakened area with mesh. Different mesh fixation techniques and closure methods, including tack fixation and suturing, can be utilized. Laparoscopic repair offers advantages such as reduced postoperative pain, earlier return to normal activities, and improved cosmetic outcomes. Hiatal hernias involve the protrusion of abdominal contents, typically the gastroesophageal junction, into the thoracic cavity through the esophageal hiatus. The surgical repair of hiatal hernias aims to restore the anatomy and function of the gastroesophageal junction. Common approaches include Nissen fundoplication, toupee fundoplication, and the use of mesh reinforcement. Each technique has its own indications, outcomes, and potential complications. Understanding the nuances of these approaches is essential in providing optimal patient care. Hiatal hernias can lead to complications such as GERD and dysphagia. GERD causes symptoms like heartburn due to stomach acid flowing back into the esophagus. Lifestyle changes, medication, and surgery help manage GERD. Dysphagia, difficulty swallowing, may be treated with nutritional support and dilation techniques. In conclusion, understanding inguinal, umbilical, and hiatal hernias is essential for medical professionals. We explored their anatomy, classification, diagnosis, imaging, surgery, and complications. We also examined umbilical hernias in pediatric and adult patients and hiatal hernias, including repair techniques and associated complications. With this knowledge, you can effectively manage hernias in your patients.